Hi, I'm Aislinn Antrim with Pharmacy Times. Today I'm speaking with Ann Webster, a nurse practitioner with Unity Point Health, about restrictions placed on medication discounts by drug companies and how that impacts patients. So, can you start by just giving me an overview of these restrictions and what they are and how they work?
So the 340B program is a federal program enacted by Congress about 25 years ago, and it requires pharmaceutical companies to offer life-saving medications at an affordable price for hospitals and patients. So it began falling apart last fall when five big pharma companies pulled out of the program. And therefore, those significant savings on life-saving medications are no longer available.
Okay, interesting. How do these restrictions limit hospitals and patients' ability to obtain drugs, and how does this affect the patients specifically?
So it's been a terrible thing for me to watch as a provider. I work in endocrinology, diabetes metabolism, and I work with mostly just diabetic patients, type 1 and type 2. I relied heavily on the 340B program to prescribe insulin, especially. They offer all kinds of medications, but my focus, of course, is insulin. So I would be able to provide insulin to people that had no insurance or people on fixed incomes like Social Security or, and they're on fixed incomes and they can't afford expensive medications. Medicare, with their coverage gap every year, people fall into that. They could not afford the insulin. So then they could turn to me and I would prescribe insulin through the pharmacy in the hospital I work with. And the patients could go there and pick up their insulin, and it was very affordable. It was under $40 a month. They could get vials or pens. It was a good quality insulin. There were a couple different insulins I could prescribe to people, some really great, newer diabetic drugs that even promote better control of their diabetes. I could get all of that at prices they can afford. And now I can't do that for them.
That's hard. Um, you've talked about diabetes specifically, and
Mhm.
you've worked with many patients who have seen these impacts directly. How have you seen them grappling with this? What options do they have? How have they been dealing with it?
So when I heard that the first three companies pulled out last fall, I mean, my office staff and myself, we felt emotionally devastated because we knew we were going to have to tell people this terrible news. And then after the first year, all of them were out. So what I've had to do is switch people over to kind of old-fashioned insulin. I'm putting them on NPH and regular insulin vials through Walmart. You can purchase that for $25 a vial. So you can imagine if I have very insulin resistant patients requiring high amounts of insulin, this could get very expensive quickly, a lot more than under $40 a month, which I could get them through 340B. So what I've been doing is switching them over to Walmart, trying my best to find solutions, which includes I have a sample fridge that I get samples from the pharmaceutical companies. I give this out to my patients. I don't want people having to ration insulin. I've seen that. I'm starting to see that more. I don't want a type 1 diabetic to not have access to insulin because they will die. So I'm offering samples from my office. Then I also am putting them in touch with the pharmaceutical companies. They offer, some help to patients that can't afford their medications. But these programs can take a while to get approved. You have to be financially destitute almost. And there's so much red tape that a lot of people never can complete all the forms. The patients I care for, some of them are, unable to go through the motions like that. They have all kinds of disabilities and whatnot.
Definitely. We've seen some increasing awareness of disparities in healthcare with diabetes and many other chronic conditions. How do these challenges that you're talking about kind of reinforce those disparities?
Well, the disparities are terrible. It actually ties the hands of the prescriber. My patients, if they don't have insurance that covers their medication well, I'm forced to use a $4 med list, which I'm glad I have it, or the insulin from Walmart. which also they are not as well controlled on these drugs. Some of the drugs are obesogenic; they promote obesity. So you're just adding more. They're gaining weight on these drugs. Uh, Pioglitazone has been around forever. It's a $4 med. It has lots of side effects, but I put people on it because I have no other choice. So the people that have good insurance, they can be on the really nice medications that are excellent with glycemic control, weight loss. They usually can get very good control of their diabetes quickly. And the people that do not have access to this are forced to use the drugs that are cheaper. They're generic now, they're available generically, and they do not offer as good glycemic control, and they can lead to more, problems down the road from being a poorly controlled diabetic.
Hmm. How do these challenges impact not just patients' health, but their financial well-being, more holistic wellness, as you've kind of talked about, obviously the financial side of it? How does this impact them more broadly?
Well, I've seen it. It really hurts me to see some of my patients who are hardworking public servants their whole lives have to feel like they're taking out handouts. And it has they feel shame over not being able to afford these drugs. Anyone that would fall into the coverage gap and they need a lot of insulin every month cannot afford it. I mean, it's just astronomical pricing. So I've seen people aren't as motivated to get their diabetes under control as they once were. They might kind of give up more. They feel like, why bother? I can't treat my chronic disease like I want to. And, the financial impact is huge, especially with COVID-19. People lost their jobs. There's all kinds of hardship. And now they pull the rug out from under their feet, and their medications they need necessary to live went up 10 times in price.
What policy or legal solutions are there? What rules might be able to address this issue? And why aren't they being enforced if they already exist?
So that's something I really don't understand. And I am a nurse practitioner, I'm a clinician. I'm usually not involved in the policies of things, but I did start looking into this more. And it's the HHS secretary needs to reinforce this federal law. The drug companies pulled out, they just made their own rules, pulled out. There's monopoly pricing with insulin. There's no value. They can charge whatever they want for the cost of insulin, and they're doing what they want right now, and it's not being reinforced, the 340B federal program. And it's really puzzling because I don't understand why they're not enforcing it. There was a statement made at the end of last year by the former HHS secretary, which was just kind of a neutral statement. It left everyone kind of still confused. And now at this time with the new administration, everything was on hold in the first 100 days. And now I think everyone's waiting to see what comes next now.
Okay. Have you seen anything kind of starting to change, or anything solid that gives you some hope?
No, nothing's changing. It's getting worse. So I still don't have a lot of options. I'm still handing out samples. I still can't prescribe the meds I want to. I'm still having to put people on obesogenic meds and whatnot, or my type 1's ration insulin. I still don't have any help there. That's why I wanted to speak on behalf of my patients today, so that it can be heard, because I don't think people understand how these affect day-to-day lives of people, and it shortens their lifespan, and it just causes so much more hardship. And I don't believe there's a face to this problem. I think lawmakers make laws, and pharmaceutical companies, they should know better, but they're doing what they want. It's all it's capitalism. It's driven by capitalism. And I wish people would just try to help their fellow man more.
Absolutely. Well, thank you so much for speaking with me. This was great. This was very informative.
Thank you so much. My pleasure.